So today we are talking about Washington's MDCE or Clinical Experience License for International Medical Grads. Our objective today is to kind of go over the history of this license and provide a brief summary of the application process, our new requirements, and what approval time will look like. We will also clarify the nomination process. So who can nominate you? What does a typical nomination letter look like? We'll also discuss the practice agreement requirements and what information is needed to complete that online. And then we'll also kind of describe and define what is an appropriate medical practice, which is still ever evolving as things change with this license. And then kind of just summarize the benefits and again, provide opportunity for questions at the end or just throughout this presentation. So what is an MDCE license? So back in 2021, legislature passed a substitute House bill or House Bill 1129 to create this limited license to practice medicine for international medical graduates who meet certain requirements, allowing them to practice in Washington state to gain clinical experience for 4 years. That was the initial bill. Well, this year, a bill was passed allowing licenses to be renewed up to 3 times, where previously was only allowed 1 year or 1 renewal. This allows the license to now be renewed 3 times, therefore extending the maximum lifetime of the license to 8 years. So previously we had it 4, now it has doubled to 8, which has been incredible because for a lot of our providers who applied in 2021, their license would be expiring this year. So was very excited to have that extension put on this license. So in October of 2021, the Medical Commission created the Physician and Surgeon Clinical Experience License after the bill passed, and our license went officially live in October. And I think either around October 30th or the beginning of November is when we actually granted our first license, which was very excited to see. Since we went live, the Medical Commission has received about 91 MDCE applications and have granted roughly 43. I think we currently even have a few pending right now. There was a spike in the beginning just due to the newness of the license and not sure which license to apply for, but with the legislation changes and the efforts that the International Medical Graduates Academy has put into facilitating education on this license, I feel like we are really going to hopefully see an uptick on applicants just due to the changes that are allowing it to be more of an expansion for this license. So excited to see that. Average processing time for this license typically is about 4 to 6 weeks. This timeline really varies during our peak season, which is between April and July. Right now, our timelines are stretched just due to the sheer volume we've received with our new licensing system. But once we work out those new kinks of a new system, our processing time should go back to that 4 to 6 week time frame. So how do I qualify for this license? So right now, as the new rules are in place as of end of July, these are what is required. So you must obtain a nomination letter from a hospital, appropriate medical practice in Washington, which I will explain in a further slide, a county or city health department, or a Washington state agency. They just have to provide a letter from the facility explaining that you're going to be nominated for this role. And I'll show you an example of what we would like to see for a nomination letter. We've received plenty and have utilized the same kind of template for that. So I'll show you what that looks like. You now only need to pass steps 1 and 2 of the USMLEs. It used to be a requirement that you had to pass all 3, but we recognize that with holding an ECFMG certification, that is only a requirement to pass the first 2 steps. So we had that changed with legislation to drop that 3rd step, which has been really helpful for some of the IMGs applying recently who haven't obtained that 3rd step. So you would need to hold an active or current certification through ECFMG, and then you would also need to establish an agreement between a physician and the nominating location who provides your oversight for supervision. So a practice agreement would have to be in place, but we have resources and examples of how that should be filled out. So it should be no problem. So the nomination process, who can nominate? So nominations must come from the chief medical officer or director of any hospital, appropriate medical practice located in Washington, or one of the state agencies like DSHS, DCYF, DOC, or any city or county health department. The letters must state the applicant's name and the facility that the organization is nominating the applicant to work at. And we must also have an official start date. And while it's not a requirement, we would like you to include who the supervising physician would be, so we can cross-reference that when we look at the practice agreement. So here's an example of a nomination letter that we've accepted in the past and kind of utilized to this day as an example when we have new facilities wanting to reach out and hire MDCE applicants, but they just don't know what exactly we're looking for a nomination letter. So this is my tried and true example. This one just includes, it's a letter of nomination. They're stating what this license is going to be for under the clinical experience. They're providing us with a start date, and they also provided us with the doctor that will be their supervisor. And sometimes they even include other supervisors that will be a backup in case that provider is on leave or is on sabbatical, whatever. They list that. It's not, again, a requirement for the nomination letter, but again, it's helpful to have because it's information that will be asked in your practice agreement. So pretty straightforward. And then down at the bottom, like I said, it would need to come from a medical director. So we always want to make sure that that's referenced in their signature. And here's just another example. Again, layout is a little bit different, but the information is still there, stating that it's a letter of nomination, stating that this will be for the clinical experience license. This will be under this person's supervision, and here are a couple of backups. So again, medical director in that signature just ties it up like a pretty bow. So for our practice agreement, this is, like I stated before, an agreement that will be with their designated supervisor. They must have this submitted prior to us issuing a license. So the commission actually will review and approve the agreement. And in order for this to even allow our system to grant a license, this has to be in place. So a lot of the times when a provider is applying and they have their they have their facility nominate them, they're sending in their nomination letter. We usually direct them, or they do it at the same time, where they go to our medical commission website and they actually fill out the practice agreement right there in our form. It's an online form that once you hit submit on that, it will actually send us an email copy, and it will email the physician and the MDCE applicant that same copy as well. So everyone gets a copy, but we certainly get a copy, and then we match that up to the application file. So It's right there. You don't have to worry about following up. We get a copy of it and we place it in your file. As of right now, supervising physicians may supervise no more than 2. Actually, I apologize. I think we have recently updated that to 4. I will have to double check on that with the new changes, but I believe it has increased. We have some facilities that have requested more. You just need to provide us with an explanation as to why a supervisor would need more than 2 or 4 MDCEs under their supervision, but we have a facility that I believe their supervisor currently has, I think, up to 12 right now. So it's possible. We just need an explanation, and then the commission would need to approve it. The supervising physicians shall retain professional and personal responsibility for any act that constitutes as the practice of medicine as defined in RCW 1871-011 or 011, or the practice of osteopathic medicine and surgery as defined in RCW 1857-1 or .1 when performed by an international medical graduate practicing under their supervision. So that just states you are full as a clinical you are designated to do and practice in the same specialty, the same scope of practice as your supervisor, and they are responsible for you under their supervision. What information do I need to submit a practice agreement? Like I stated before, we have an online portal or an online form on our website. It pretty much walks you through everything. It will tell you to list your name, license if available. Sometimes a lot of our providers may submit this information to us prior to actually even applying. We don't have it where it's completely locked for numeral fields. You can put in just pending and we'll match it up once we get your application. But if you have an application number or license number, you can put that in there. It will ask for your contact information and medical specialty. Same for your supervising physician. They'll want the license number, contact information, and medical specialty. Again, to kind of match up to make sure that you are, being supervised and doing work that you are being nominated for and have that same training. List of any alternate supervisors who will be available when your designated supervisor is out of the office. And then this is where you would kind of briefly tell us an outline of the practice and what the clinical duties that the applicant will be doing at this facility. And then you would select the appropriate statement for a sponsoring relationship. And I'll kind of show you an example of that in the next slide. And then reiterating, once submitted, the portal will email the commission a copy of the practice agreement. So once we get that notification through that it was submitted, then we can match it up to your application. So here's an example of some sponsoring relationships. This kind of we took off or utilized with our physician assistants when they were doing their collaboration agreements and they had to submit it to the commission. It's just kind of giving us an idea of how supervision will go, whether it will be available for face-to-face supervision or phone consults, chart review every certain amount of days. You certainly do not have to choose one of these options. You can formulate your own, just whatever you and your facility and your supervising physician has decided on. But when this was first launched, there was not a lot of experience with our IMGs getting this type of supervision. So we provided examples of what would be acceptable for the commission. But I think since this has grown over the last 4 years, that has changed just a little bit. So you do have a little bit more freedom. We just want it outlined some way in the agreement. And so, talking about the appropriate medical practice, this was a criteria that we had in rule. I believe actually this is changing at least some of the terminology in our rule. So, I couldn't find the exact verbiage that we are changing it to because we're in the middle of changing that whole chapter. But as of right now, this is kind of the guidelines that we go off of. So to qualify as an appropriate medical practice, a facility must be physically located in Washington state and provide clinical care to Washington patients. We have a couple of practice setting requirements. So one is operate within a federal system such as military, Indian Health Services, tribal health, and community health centers. Or two, just being employed at a facility that has at least 3 physicians. So it could be a combination of MDs and DOs, or all the DOs or all MDs, but there needs to be at least 3 physicians on staff. And they would also need to be the ones that deliver direct patient care and participate in a quality review, improvement, and assurance programs for this facility. So that's the criteria. Again, I believe there may be some tweaks to this verbiage when we update our rules, but we haven't fully updated that yet. So if you have questions about me or about this information, at the end of the slideshow, I do have my contact information, so please feel free to reach out if you want clarification on that. So the benefits of this MDCE license, this was the first Washington license created specifically for our IMGs to practice under supervision within their full clinical scope. The MDCE license is valid for 2 years after the date of issuance. So if we issued a license today, August 6th, that license would be valid until August 6th of 2027. And it now, like I stated, can be renewed 3 times, so making this a lifetime license of 8 years. Our traditional license and a lot of our other limited licenses are usually only valid for a year. For actually our MDs, sometimes it could be even less than that. It could be 91 days because they go off their date of birth and where their date falls within issuance. So for MDCE, we wanted to make sure you guys had a full 2-year experience, especially because you guys have a shorter lifetime with this license as of right now. So we wanted you to get the most out of that. And we thought 2 years from the date of issuance would be the best for that. So our hope and goal for this license is that after practicing up to 8 years clinically, the IMG would be able to match into and complete a post-grad training program and be able to maintain or obtain a full MD license in the future. I know we are working legislative ways to create different pathways. I'm hoping to maybe speak on that next year if things go according to plan. But as of right now, that's our goal, our hope for this type of license is that this would allow you to be able to use this as a way to get matched into a program so you can complete that and get a full license with us. And then just the fact that we are able to allow more IMGs to be able to be back into the field and to provide medical care for our patients in Washington. It's just an untapped resource that we're happy to allow IMGs to just come here and help us. So very thankful for that. And again, every year it feels like we're evolving this license. Again, happy that I was able to make these changes from what this presentation was last year. And I'm excited for what this will be next year. So with that, here are all of the resources, and I will make sure Dr. Khalif and Peace have an updated version of this presentation. So if you wanted to utilize these new links, certainly feel free. And then I would love if you guys could take down my contact information. And if you have any questions about this license or any of the new changes coming to Washington, please feel free to reach out to me and I'm happy to answer any of your questions. So with that, go ahead. Go ahead, Dr. Khalif.
Hey, Marisa, thanks for coming on. Sorry I can't be on camera. I'm not feeling well today, but I had
Oh,
to
no.
attend. I had to attend this meeting because we're always thankful that you're coming on and educating our community. So thank you so much
Yeah,
for taking the time.
no
Um,
problem.
so I wanted to ask. So we have on the call a lot of people that do not live in Washington State, and so that's one of the things that we changed this year was like so anybody could come here and qualify for the license. So before it was 1 year. Can you talk about like uh, how the medical commission is uh, you know
Mhm,
facilitating that? Is it before? I know there was an ID required. So
mhm.
is that not required anymore, or like how? Can you, if
Yes.
you talk about that? Yeah.
Yeah, love to touch on that. That was something I felt like I was missing something when I was talking about my requirements. Again, I just went on deleting everything because everything kind of changed. So, yes, prior to July, I believe 27th is when that technically went um into effect, we had a 1 year Washington resident requirement for this license. So that required that by the time you submitted your application, you needed to either have a Washington driver's license or ID that was issued 1 year prior to applying. It even got strict of like there was a couple of people who literally we had to hold their application like a week to 2 weeks because of that 1 year requirement. Now, as of July 27th, that is no longer a requirement. So essentially, if you are nominated by a facility and you do not live in Washington, you can still apply. We just need to, most likely, that we will verify is just basically chronology since you have completed medical school. Just so we have an idea of what you have been doing since you graduated from medical school, or unless it's been over 7 years. Typically, we do 7 years or less for chronology. But no, we had two applicants that I just granted a license to last week who were nominated. Where are they nominated? Um, with the same facility, but they were from the East Coast. So they literally, as soon as they got their license, they, I believe, hopped on a plane and came to start just because they were waiting for us to get through our peak season and that rule to go into place. So no, when you apply, as long as you are nominated and you meet our other requirements of having ECFMG and the first two steps of USMLE, you meet our requirements for this license.
That's amazing. And before we get to some of the chats, one more question, Marissa, that I've been here, but that people have been asking me is, um, does the medical commission share any data with federal authorities?
No, no, we do not, which I am very thankful for. All of that information is there are some things that are public disclosable. I don't know the specifics on that, but for the most part, um, it's just mostly like it's a normal PDRC request or a public disclosure request. But they can't get your like personal contact information that is not disclosable. So, but outside of that, we do not talk with any immigration or federal, nothing. I'm very grateful that we do not. So,
Awesome. Thank you so much, Marissa. So getting to some of the chat questions. So we have a few questions in the chat. First, I will start with Marcelo, and he says, "Hello, Miss Courtney. Thank you for your time and amazing presentation. I'm set to begin a fellowship at Seattle Children's on September 1st. A date postponed due to ECFMG certification delay.
Mhm.
I meet with the core. I met the core requirements, but the portal remains closed with no timeline. In urgent cases like this, does the commission offer any support, flexibility, or expedited pathways such as MDCE, supervised license, or any other route? So, does the medical commission basically have any alternatives for somebody who's facing delays with ECFMG certification?
Yes. So certainly take down my contact information, please. We're kind of we're still wrapping up our peak season, so I apologize. My uh train of thought gets scrambled everywhere, but I really want to make sure we get you taken care of. So if you wouldn't mind just emailing me this chat information, I will look into this for you. I believe with Seattle Children, we are okay to give you a resident or a fellowship license. We just need to confirm with Seattle Children's that they will take it. But with those type of limited licenses right now, you do not need ECFMG certification to obtain that type of license. They may still require it internally with their facility, but to actually have a license in Washington to practice, at least within some capacity, that is not a requirement. So please take down my email as soon as we're done here, or even if you want to type it up now, send it to me. I will look into it for you and get you a response either by the end of today or very early in the morning tomorrow.
Awesome. So moving on to the second question, Marisa, Rami Hakim asks, can you receive a medical license number before submitting a physical agreement? And I think, Rami, you might mean a practice agreement. If not, you can clarify and unmute as well. So that's the question.
Yeah, so I mean, we have plenty of providers who they at least just get an application into us. They either apply online or they mail in a paper application. You do not need to have everything complete in order for you to get a license number. So as long as we have an application, that will trigger a license number. It may just take a little bit longer depending on how you apply. Right now, our Helms portal online instantly gives you a license number as soon as you pay for your application. If you mail in a paper application, that means my staff has to actually manually enter you into the system. So we're kind of in a little bit of a backlog due to our peak season to manually put things in, but you will eventually get a license number and you will be notified via email. If you do it online and have the ability to apply online, you will get an email instantly with your license number. So hope that answers your question.
Thank you. So the next question is from Harleen Mann. Harleen, if you want, you can unmute or you can put it in the chat as well. But you can unmute and ask your question.
Thank you. Yeah. Hi, Marisa. I have a question. So, can you talk about the 7 year timeline? So, I've been out of med school like more than almost 10 years now.
Okay.
Um, but I have passed my step one and step two and been
Mhm.
active in, medicine, doing some rotations here and there. So, am I still eligible?
Oh yeah, no, the 7 year time frame is just to give us an idea of what you've been doing. So just it's kind of like a short abbreviated resume or CV. Um, Previously, we used to have providers have anytime that they applied for a license with us, they would have to list literally every single type of employment that they had since graduating from medical school. And there are times where we had older physicians who have been actively practiced and out of medical school for 30 years. So they're having to remember all of the locations, all of the places that they had worked since that 30-year graduation date. And so we shortened it. So it was either what have you done since graduation or 7 years ago from today, what have you been doing? So that's just to give us an idea of clinically what have you been doing. But it's not anything that we're going to make you ineligible for. If there's gap in chronology where, let's say, you took time off to have a baby or to care for a family member, you just tell us from this time to this range, I was unemployed or took a sabbatical because I was having caring for children or caring for a family member. We have that happen all the time, but it does not disqualify you at all.
Yeah, just last one
Thanks.
question. Oh, sorry.
No, go ahead, Harleen.
Sorry, last question. So you said like we have to list the specialty. Is there any way we can do it for two specialty, like for example, internal med and family med, because they both overlap with each other?
Yeah, that's fine. We just kind of would like demographically, whenever you renew, you get a demographic survey. They kind of want to put you in a category of like, how are you practicing? What is your specialty? Are you mostly telemedicine, that type of stuff? But if you provide us with two specialties, we're not going to hold you to it. We just like it for demographic purposes.
Awesome. Thanks, Harleen, for your question. Next question we have is from Aura, and she asks, for the nomination letter from the facility, would a start date expedite the processing of the MDCE license? Thank you so much for your support, Marisa.
Thank you. I wish I could tell you it does. For the most part, if I am made aware of a start date that's coming up and it's impending a provider from not being able to start, I will kind of take that application under my wing. That's what I had to do with the other two that were coming up soon. I think they had a start date of the 1st, and I had to issue it literally on the 31st just due to our volume. But typically, as long as it's a reasonable request, like I would ask that you don't submit an application, let's say tomorrow, and then expect to be licensed by Friday. That I can't do. I'm great. I'm just not that great. But if it's a couple weeks out, certainly if you again take down my contact information, I may not be able to email you right away, but I tend to try to get you at least same day or next day an answer. But if I'm aware of a date coming up and you need it for employment, I tend to, because MDCE license was like my first license creation as a licensing specialist. It's kind of near and dear to my heart. I tend to put you guys a little bit higher up, at least in my queue, for issuing. So if you have a start date that is coming up quickly, and let's say you haven't heard anything in the first 2 weeks, then reach out to me and I will see what I can do for you guys.
Awesome. Next question, Rami asks for like how to apply for jobs. But hey, Rami, you can definitely reach out to Peace or myself, and we can route you to a specialist who can advise you better on that. So definitely reach out to me and Peace on, and and we can even refer you to some of the jobs that our partners have open as well. Next question is Yvette. And Yvette Mission maintain a list of approved employers or designated emergency sites where MDC license holders can work.
We unfortunately do not have a list. I mean, I know of places that I have approved for the license, but unfortunately, with the medical commission, we have to kind of stay very neutral and unbiased of locations. I have utilized Dr. Khalif a lot of saying, hey, I have this person reaching out to me. Can you get them in contact with anyone? I would say maybe utilize those resources, but unfortunately, I cannot, within my job description, recommend a facility for you to go to. But if you contact me and say, do you know or have you granted a license with this location before, I can at least tell you I have or I have not.
Awesome, thanks. Yes, Yvette, so definitely reach out to us on all job-related questions, we can definitely, we have some specialists who can definitely help you on how to get it. And we do have experience of placing a lot of people in those different type of jobs. So
Yeah.
definitely reach out to us. So awesome. Next question, Solomon asks, thank you so much for this wonderful presentation. So far, I have been applying to many places, but most of them are not aware of this pathway. Are there any list of specific places which are currently accepting applications? Again, Solomon, yeah, this is a job-related question. The state has to, remain neutral when it comes to different sites, so they're not favoring one business over another. So, but you can definitely reach out to us, and we can definitely help you on, how to reach out. There are some techniques that we learned that work well. So, next question. Let's see. Sarab asks, great presentation, Marissa. Appreciation to WMC, Dr. Tikali, for all the work. How long will it take to process the application once we have completed the application with all of the required documents submitted?
Yeah. So as of right now, we have probably one of the I would say we have a guideline or a what do you call it? A metrics with the governor's office and the Secretary of Health that once a license or an application is fully complete, we have to grant that license within 14 days. Thankfully, my staff in the process we have done with our production is to grant a license every Friday. That is where we designate our final approval. My licensing lead and myself tend to do things ad hoc. So we may grant a license randomly throughout the week, but traditionally you have 14 days from the date that we tell you we have a complete application that you'll be licensed. But realistically, if we send you that email at the beginning of the week, most likely by that Friday at the very latest, you will be granted a license. So we try to keep it within 5 days. I think the metric says 14 days. And I'd say right now, even with the hiccups with the new system, we hit that about 86 to 90% of the time. And we will let you know if for some reason it has to be delayed. But usually, like I said, with you guys, because I know you guys have that start date and it's already hard to get you into these positions. Or not hard, but just educating the facilities. We don't want to impede that at any point. So that's when I will usually jump in and issue an MDCE randomly throughout the week so you guys can get that start date. But typically, also, what I will say, a lot of facilities who have hired our MDCEs, what they do is they give us a date and then they will contact me and let me know, and I will give them a realistic answer. And that's when they'll usually add they'll give me a date or based on how long it takes for credentialing. And that kind of gives us a little bit of wiggle room and it doesn't impact you guys as much. But again, I'm usually in the know with our MDCE licensees when their start date is, and I will either tell you straight up if it's a doable date or if I say it's reasonable, then I will usually put you guys at the first of my queue to make sure that you guys are being taken care of and we can get that date or even before that date so you guys don't have to wait on us.
Awesome. Next question, Harlan asks, does the employer have to be a hospital or could they be like a small clinic?
So as long as they're employed by 3 physicians, like I stated, it could be a DO, MD, combination of those. It just needs to be a clinic of 3 physicians or more.
All right. And the next question, Sarab asks, this is equally important for someone living, okay, outside. Okay. I think this is a continuation of his first question.
Yeah.
So next question, okay. Great presentation. Thank you, Marissa. Mohammed, can you please share your contact information? Definitely, Peace will share, Peace, if you can share our, main inbox. So you can definitely reach out to us and we have like info@timga.org, which is where we can get to everybody very quickly. So we'll share all our information as well. Next question is Charles. Charles asks, is it a physician? Is the MDCE license a physician or a physician assistant position? License basically. And
Yes.
what type of license is the MDCE
Mm-hmm.
license?
So it is categorized under a physician, and it is under our limited physicians only, just due to the fact that you are having to be tied to that facility through a nomination. But something that was established with this new bill is to define what this license holder would be, and you would be fully employed as a physician. You would have supervision, but you are working as a physician. You have the same scope and capability as any full MD. You just have that added on supervision piece. But they have to hire you as a physician.
Awesome. And Marissa, one more question going back to the appropriate medical practice for people on the
Mhm.
call who are right now like talking to employers and looking for jobs. Is there a possibility that those requirements might like soften up a little bit to facilitate work opportunities
I
for people?
I feel like there was conversation. I apologize that I didn't look into that a little bit more as I was updating. I know there has been many conversations about lessening that number. I don't know if that was established in this new rule. I will follow up. But I know that there is still fight for that number to go down. I know when this was established in 2021, we had a few facilities that were dying for MDCEs to be able to be licensed, but they only had one physician on hand, and we couldn't budge on that. But I do think that that requirement will be softened as this continue and as the need grows. I just don't know if it was established in this rule or bill that was passed. So I will follow up with that. I will check with Micah and just get clarification on that. And I will get back to you when I send you guys this presentation as well, just so you can share it with everyone else.
Thank you so much. There's another question in the chat that just came up. Hardy asks, are employers familiar with the MDCE license? Can we direct them to you in case the employer has any question about this license?
I mean, you certainly can. Again, as the licensing agency, I can give them guidance on what our requirements are in regards to supervision and what a nomination is. I've had to do that for a couple of facilities. I know Micah has too, our deputy executive director. That his title is a little, it's basically he's our deputy director, and he's also our legislation liaison. We both have been educating a couple of facilities that are looking to expand, but it's still an ever growing thing. I feel like we are making headway with some bigger facilities like UW. I feel like they're starting to understand a little bit. So I wouldn't be surprised if maybe they start to look into this a little bit more, but we're trying. Certainly, if you would like to give them my contact information, I'm happy to provide them with guidance. It's just, I wish that we could tap into it a little bit more, but I know Peace and Muhammad do a great job of educating too. It's just, it's going to take a little bit more time to get everyone, but I feel like we're in the right direction.
Yeah, definitely. I agree with you. And the second part of the question is directed to me. And yes, Harleen, you can definitely, anytime you can like connect people or connect employers to me, I'm definitely welcome to meet them even in person to talk about this license. And as Marissa said, yes, it's going to take some time, but it does work. Like 3 years ago, CMAR, Community Health Centers, they told me that they were not going to hire
Yeah.
MDCE ever, and now
Yeah.
they started hiring. So
Mm-hmm.
so like people do change their minds, and I think it's just gonna take some time for people to understand the license. And as like you guys start working and have more success, that's even gonna help the license even more. So
I agree. Yeah.
awesome. It looks like we have no more questions, Marissa. I want to thank you so much for your time and
Yeah.
Any last words that you want to like share with everybody?
No, I mean, I am really excited. If you're really interested in this license, I would really try to utilize all the resources that we provided to educate yourself on how to even promote yourself to some of these facilities. It is a great opportunity, and we're fighting really hard to make this a license that can actually be worth something and not like a waste of time. We want you guys to be able to clinically work in Washington. We need you guys to work here. So just know that we're doing everything in our power to fight for you guys. Don't get discouraged if a facility may not recognize what this license is. You can always contact me. We're here to help you, and I really wish you luck in the future with hopefully becoming a provider that practices in our state.
Awesome. Thank you so much, Marissa. I hope you have a great rest of your week. And thank you, everybody. There's looks beautiful outside and sunny, so I hope everybody gets some sunshine.
Yes, thank you so much.
All right. Take care, everyone. Bye.